Have you been feeling that your mind is slower? Do you forget where you put your keys? Are you having trouble remembering names or even keeping focus during a simple conversation? Be careful. What you call just a normal part of aging might actually be the first sign of something much more serious. And what's worse, something that could be prevented with a single nutrient that almost no one consumes as they should. I am a doctor, and I have been working for over 10 years with seniors who want to age with autonomy, mental clarity, and health. And today, I will show you the hidden truth behind one of the main causes of mental confusion, fatigue, and memory loss in old age. But before continuing, if you care about your health and want to live with greater longevity, subscribe to the channel now and turn on the notification bell. That way, you won't miss any essential content like this. And tell me in the comments, from which city or country are you watching us? This helps me know how far this warning can reach. Stay with me until the end, because I will show you not only the name of this forgotten vitamin, but also how to identify if you are at risk. What are the invisible villains that block its absorption? And what to do even today to protect your brain and your memory. It is a simple, direct plan that can transform your life, or the life of someone you love. There is a widespread and even dangerous idea that forgetting names, losing track of a conversation, or confusing dates is part of the aging package. It is as if we accept that, upon crossing 60, the mind begins to fail like an old battery. But this, my friend, is a costly misconception. As a doctor and longevity scholar, I assure you, not everything that looks like age is healthy aging. There are hidden causes that no one tells you about. That mental confusion that appears slowly, that blank that makes you forget where you put your keys or your grandchild's name, can have a silent and treatable origin. Often, behind these lapses, there are subtle nutritional deficiencies, neglected even by routine exams. And here's the curious thing. Most of my patients arrive at the office thinking they are becoming a bit senile, when in reality their brain is simply malnourished. It is no exaggeration to say that forgetfulness is becoming a new normal, but it shouldn't be. Over time, we stop observing the signals the body gives and start accepting them as inevitable. But healthy aging is built with information, disease prevention, and lifestyle habits adjusted to the new phase. Longevity does not go well with resignation. It demands attitude. And everything starts by stopping the normalization of what is not normal. Have you ever stopped to think how many lives could be transformed if we treated forgetfulness as a symptom and not a sentence? The good news is that it is possible to act, and the sooner the better. The mind can indeed remain firm, lucid, and resilient over the years. But for that, it is necessary to abandon this myth and face the true risk factors that hide behind this mental fog. Few people know, but the brain is a demanding organ. And among its most essential fuels is vitamin B12, a true invisible guardian of our lucidity. This vitamin acts in the formation of myelin, a substance that protects our neurons like the insulation of an electrical wire. When it is lacking, the brain connections start to fail, and with that, memory, focus, and well-being suffer the impact. It sounds like an exaggeration, but it is not. We are facing a pillar of mental longevity. And the most curious thing is that B12 is abundant in nature. Present in meats, fish, eggs, and dairy products, it should always be at ideal levels in the body. However, that is not what happens. Even with adequate nutrition, many seniors live in a state of chronic deficiency without knowing it. Doctors like me have been observing this with increasing frequency. A patient told me, "Doctor, how can I be deficient if I eat everything?" And that is where the mystery of poor absorption begins. The neglect with B12 is so great that even routine exams fail to alert about low levels. Traditional medicine usually considers values normal that for a mature brain are already dangerously insufficient. This inattention is costly. The absence of this vitamin is related not only to memory loss, but to the increase of homocysteine, a silent villain linked to strokes, heart attacks, and early cognitive decline. It is as if the body gave signals, but no one listened to them. You who are listening to me now may be among those who have never heard of this, and that's okay. Most of my patients only discover this reality when they are already facing disconcerting symptoms. But that is where the power of information comes in. By understanding the importance of B12, we take a concrete step towards health in old age, disease prevention, and the construction of healthy aging with autonomy and lucidity. Imagine a thief entering your house day after day, taking small things. First the keys, then a notebook, an old book, and only when something valuable disappears do you realize it. That is how vitamin B12 deficiency acts. Discreet, slow, and almost imperceptible at first. The body does not give an immediate alarm. There is no pain, no fever, no spots. Just an unusual fatigue, an irritation without reason, and that constant blank in the middle of a sentence. These vague signs are so easily attributed to stress or age that most people do not even think about investigating. A patient of mine, Donna Lucia, 71 years old, used to say, "Oh, doctor, it's age catching up. I don't even remember where I put my slipper." But her exams revealed another story. She had low B12 levels, even eating meat and eggs regularly. That is, it was not a diet problem, but a compromised absorption, a detail that almost went unnoticed. This silent deficiency does not only affect memory. It directly interferes with general well-being, emotional health, and the ability to reason clearly. Many seniors spend years living with a depressed mood, with difficulty concentrating, believing they are just getting old. That is why we talk so much about disease prevention. Detecting this deficiency can be the key to reversing symptoms that seemed hopeless. Healthy aging requires attention to these subtle details. Health in old age depends on constant vigilance over the risk factors hidden in the fine print of everyday life. When we understand that B12 can disappear from our body without leaving visible clues, we gain a new sense of urgency. And the most curious thing? Even routine exams do not always capture this deficiency in time. Therefore, it is worth looking more closely at what the body is trying to say in the fine print. When the body crosses the border of 60 years, many things change, but not always in the way we imagine. The brain, for example, does not necessarily get weaker, but rather more demanding. It is like an old car. If you change the oil, calibrate the tires, and use quality fuel, it will run for many more years. But if you neglect the care, the wear appears quickly. It is the same with the brain, and vitamin B12 is one of those essential fuels. After 60, our body naturally produces less stomach acid, which directly compromises the absorption of B12. For those who do not know, stomach acid is like a biochemical scissor that releases this vitamin from food. Without it, even a rich diet can be useless. Furthermore, cerebral blood flow tends to decrease, making it difficult to transport vital nutrients to the noblest regions of the mind, such as the hippocampus, responsible for memory. Another critical point, the reduction of myelin levels. This substance is the protective sheath of our nerves, and over the years it naturally wears out. Without vitamin B12 to help rebuild it, the brain circuits become more fragile, prone to failures. That is why many people report difficulty remembering names, keeping focus, or even organizing simple thoughts. And, unfortunately, all this is usually seen only as signs of age. So, the good news is that this process does not have to be inevitable. Healthy aging begins with the awareness that the brain can indeed remain strong, agile, and resilient. But it depends on specific care. Being attentive to these subtle changes can be the differential between an active mind and a foggy mind. And all this leads us to a crucial question: how to identify the clearest signs that the brain is suffering. Have you ever felt that you are more forgetful than normal? Maybe you asked yourself if you are becoming a bit out of it, or even found it funny when you forgot where you parked the car, or where you put your glasses, again. But attention, these frequent episodes can be a warning sign. Recurrent forgetfulness, no matter how small, are like small cracks in a wall. If ignored, they can compromise the entire structure over time. Besides memory, the mind can give other important warnings. Mental confusion, difficulty following a conversation, or that feeling of being cloud-headed are also frequent in those whose vitamin B12 levels are dropping. Donna Nede, 67, told me, "Sometimes I stand looking at the cabinet without knowing what I came to get." Symptoms like these, when added up, indicate that something needs to be investigated. Longevity with lucidity requires early attention. Another worrying and little-known indication is tingling in the hands and feet. It seems simple, but this symptom points to damage to the peripheral nerves, damage that B12 would normally prevent. Added to this are constant fatigue, even after a good night's sleep, and sudden mood swings, such as irritability without reason, apathy, or even a vague sadness. All this compromises well-being and can be confused with depression, which delays the correct diagnosis. And finally, pay attention to subtle signs of balance. Mild dizziness, imbalance when walking, or even frequent tripping can indicate that the communication between the brain and the body is failing. These signs, when viewed in isolation, are easy to ignore. But together, they tell a clear story. A story that needs to be read urgently to avoid worsening, and what prevents the body from taking advantage of this essential vitamin. The villains may be where you least expect. It is not enough to eat well if the body cannot absorb what it needs. And this is where the hidden danger lies. Many seniors believe they are doing everything right, maintaining a diet rich in meat, eggs, fish, but they continue with symptoms of fatigue, memory lapses, and even dizziness. The reason? Vitamin B12 may be being silently blocked by habits or conditions that are little discussed, but extremely common in old age. Let's talk about antacids, for example. Medicines like omeprazole and pantoprazole, so used for reflux and gastritis, reduce hydrochloric acid in the stomach, precisely what is necessary to free B12 from food. Donna Ruth, my 73-year-old patient, had been taking these medications for 8 years. She would say, "Doctor, I eat meat every day." But her exams showed severe deficiency. The blockage was in the stomach, not on the plate. Another silent villain is excessive alcohol consumption, even social drinking. It damages the gastric mucosa and interferes with the hepatic metabolism of the vitamin. And we cannot forget restrictive diets without animal products, which, without supervision, are an invitation to B12 deficiency. There are also cases of patients who have undergone bariatric surgery or suffer from diseases such as atrophic gastritis and colitis, conditions that directly compromise absorption. Longevity and health in old age require us to look beyond the obvious. Nutrient absorption is as important as, or more important than, ingestion. Disease prevention and well-being are not born only from eating the right things, but from ensuring that the body is functioning as it should. Now that you understand the hidden enemies, you might be asking yourself, is it possible to recover even after years of living with these blockages? Medicine, when well applied, is a science of hope, and nothing better illustrates this than the real cases we see in the office. Enrique, a retired professor of 74, came to me with a worried look. His wife feared the worst. Alzheimer's. He repeated stories, forgot appointments, and confused his grandchildren's names. But what seemed like the beginning of an irreversible decline was, in fact, a severe vitamin B12 deficiency, something totally treatable. With the right plan, in a few months, Enrique regained his lucidity. We started supplementation with methylcobalamin and adjusted his diet. We also suspended the prolonged use of omeprazole, a detail that made all the difference. Gradually, his mood improved, his memory stabilized, and in 4 months, he was already volunteering to teach history to neighborhood children. "I became myself again," he said, smiling. This type of recovery is not a miracle. It is science, prevention, and action at the right time. Other patients, like Donna Lydia, 69, lived isolated, thinking they were getting senile. A simple homocysteine and vitamin B12 test was enough for us to discover the real cause. 3 months after starting treatment, she was already participating in the discussion groups of the senior center, laughing, remembering, interacting. These stories show that the body's resilience in old age is real, provided it is listened to attentively. That is why I insist so much. Healthy aging is not a matter of luck, but of choices and knowledge. There are thousands of Enriques and Lydias out there, suffering in silence by ignoring that everything can change. And when we talk about transformation, it is not just in behavior, but also on the plate. Shall we discover which foods are true allies of your mind? When we talk about health in old age, we immediately think of exercises and medications, but we often forget the power that comes from the plate. Longevity is intimately linked to our lifestyle habits, and food is the foundation. Vitamin B12, for example, is found exclusively in foods of animal origin. And mind you, I am not talking about sophisticated foods, but simple, accessible, and vitality-filled ingredients. Beef or chicken liver, for example, is one of the richest foods in vitamin B12 in the world. A single 100-gallon portion can provide more than 1,000% of the recommended daily need. Can you imagine? It is practically a natural capsule of brain health. Sardines and salmon are another highlight. Besides B12, they provide omega-3, which protects the heart and improves cognition. That is a true anti-aging combo. And we cannot forget eggs, especially the yolk, which many avoid unnecessarily. The yolk is a powerful ally for the brain. Cured cheeses, like Parmesan and provolone, and good old natural yogurt also enter this list of nutrition champions. Including these foods 3 to 4 times a week, in a balanced way, already makes an immense difference in the prevention of cognitive diseases and the general well-being of old age. But attention, it is not enough to eat. It is necessary to absorb. And as we saw before, factors like the use of antacids or stomach problems can block this absorption. Therefore, the secret is in the combination: conscious eating, plus medical attention. Even so, there are cases where only this is not enough, and when food alone does not take care of it, a powerful ally comes into play. Many people, upon discovering they have B12 deficiency, rush to the pharmacy and buy the first bottle they see on the shelf. But here's a truth that few doctors explain. Not all B12 is the same. There is a huge difference between taking a generic supplement and following intelligent and personalized supplementation. The form of the vitamin, the dose, and the method of administration make all the difference in the impact it will have on your brain and your health. The most effective versions of vitamin B12 are methylcobalamin and hydroxycobalamin. These forms are more easily absorbed and utilized by the body, especially in people over 60. On the other hand, cheap supplements based on cyanocobalamin may even be listed as high dose on the label, but they do not deliver the expected results. In the office, I see patients who spent years supplementing wrongly and without any clinical benefit. Another crucial point is the format. Depending on the state of stomach absorption, common tablets can be useless. In these cases, sublingual or even injectable administration is the most indicated. But this can only be defined after a good blood test and a careful evaluation. It is the kind of care that differentiates those seeking longevity with quality of life from those who are just trying to manage alone. Therefore, supplementation should not be seen as a shortcut, but as a precise strategy tailored to measure. In my clinical practice, I usually say, the right supplement at the right dose with the right follow-up can guard your memory for decades. But even with all this, the key to prevention is in something that many people still ignore: knowing the right time to act. And that moment starts with a clear and well-executed plan. The time has come to transform knowledge into action. It is not enough to know. It is necessary to act. And the first step of the action plan to protect your memory begins with something simple and accessible: exams. Ask your doctor for a blood B12 vitamin dosage, but do not stop there. Also ask for homocysteine and, if possible, methylmalonic acid, MMA. These markers reveal what the symptoms have not yet screamed. Disease prevention begins before the signs become severe. The second step is to carefully review the use of medications that may be sabotaging your absorption. Omeprazole, pantoprazole, and the like may seem harmless, but used for years, they silently block B12 absorption. Talk to your doctor. Ask if there are alternatives. Often, small changes bring big gains for your health in old age. It is in this kind of detail that the resilience of healthy aging lies. Third, adjust your diet. It is not about crazy diets, but about frequently incorporating foods rich in B12. Include eggs, sardines, liver, cured cheeses, and lean meats in your weekly routine. And if you are vegetarian or have low absorption, go to the fourth step. Supplement intelligently, with professional guidance and the correct form of the vitamin. Remember, each organism has its peculiarities. What works for one may not work for another. And finally, share this knowledge. Talk to your siblings, neighbors, club colleagues, that friend from Domino's who is forgetful. You can be the link between information and prevention. Health in old age is strengthened in community. Longevity is also built with solidarity. As I always say in the office, aging with lucidity is possible, but it starts with conscious choices today. And now that you have this map in hand, what will you do with it? Now tell me, have you ever had any of these symptoms and never thought it could be a lack of a simple nutrient? Write here in the comments. Your experience can help many people who are going through the same situation. And if this video alerted you, taught you something new, or made you think differently, do not forget to like, share with someone special, and subscribe to the channel. This helps this content reach further and guarantees you access to new information that can change the course of your health. Oh, and keep an eye on the screen. There is a recommended next video just waiting for you to click, with more practical tips, impactful revelations, and strategies for you to live with more well-being, autonomy, and mental clarity for many years. See you in the next one. A big hug, and take good care of your mind. It is your greatest treasure.